Hello everyone, welcome back to this short tutorial from Pathology Made Simple at ilovepathology.com. In this short tutorial, let's learn a very important and a very simple hematology concept called normocytic normochromic anemia. So in the next few minutes, let's see what anemia is. We will look into how anemia is classified. Particularly, we will be seeing the morphological classification of anemia and then in detail about the normocytic normochromic anemia in terms of the causes of normocytic normochromic anemia, the pathogenesis, and how to evaluate a case of normocytic normochromic anemia. So I'm sure you all know that anemia by definition is reduction of the total circulating red cell mass below the normal limits, right? So practically, it's very difficult to demonstrate the total red cell mass, and that's why, in practice, what we usually do, what the laboratories usually do is anemia is usually diagnosed based on the reduction in the hematocrit, that is the ratio of packed red cells to the total blood volume, which is what we call packed cell volume or PCV, right? And the reduction of hemoglobin concentration of the blood to the levels that are below the normal range. So this reduction in the hematocrit as well as the reduction in hemoglobin concentration roughly corresponds to that of total circulating red cell mass. Now there are various classification systems of anemia, but then for today's tutorial, what I'm going to concentrate is on the morphological classification of anemia, which is basically based on the size of the red blood cells as well as the degree of hemoglobinization of a given red blood cell. For you to understand the size of the red blood cell, whenever you're evaluating a peripheral smear, what you should look at first is the small lymphocyte, because the normal red blood cell is roughly equivalent to the size of the nucleus of small lymphocyte. Remember, normal red blood cell size is roughly equivalent or equal to the size of the nucleus of the small lymphocyte. So you need to look into the small lymphocyte first and then compare the size of the RBCs with respect to the small lymphocyte nucleus. So if it is equal to that of small lymphocyte nucleus, then it is normocytic red blood cell. Okay, if it is small, it is microcytic, and if it is larger than that of a small lymphocyte nucleus, then it is macrocytic. Very simple classification, right? Normocytic, microcytic, and macrocytic. Now, depending upon the chromia, I mean, depending upon the amount of hemoglobin concentration in a given RBC, we call it as either normochromic or hypochromic. Sometimes it can be hyperchromic as well, but then by and large, the two important things you need to know is normochromic and hypochromic. What is a normochromic? The normal pallor of the red blood cell is roughly around approximately around one third of the diameter of the RBCs. So this is normocytic and normochromic. Where if it is more than that, the central pallor is more than one third of the diameter of the RBC, then it is called as hypochromic. So what is this? This is microcytic and hypochromic. So this is macrocytic. So this is one way of looking at size of RBCs. Of course, these days you do have automated analyzers where it gives the mean corpuscular volume. So based on that, see the normocytic cells are having mean corpuscular volume of around 80 to 100 femtoliters. The microcytic less than 80, they are referred to as microcytic, and more than 100 femtoliters, they are known as macrocytic RBCs. So you have three different scenarios of peripheral blood smear examination. What is this? The first one, you can easily make out that the size of the RBC is roughly equal to that of the nucleus of small lymphocyte. So therefore, this is normocytic and normochromic, and that is microcytic and hypochromic, and that is macrocytic. Okay. Now coming to the normocytic normochromic anemia. So, this is a type of anemia which is characterized by the red blood cells that are of normal size, that is normocytic, and have a normal hemoglobin content, that is normochromic, right? So, you have a diagnostic criteria to call it as normocytic normochromic anemia based on the criteria devised by Bonnet JD way back in 1950s. What are these criteria? The first criteria is hemoglobin value concentration less than the value appropriate for the patient's sex and age. The second important diagnostic criteria is MCV 80 to 90 femtoliter. Of course, we saw In the earlier slides, we saw that less than 100 and more than 80 is normocytic, right? So that can be considered, but then this was the earlier diagnostic criteria, but then now it is stretched up to 100 femtoliters. What is important is remember mean corpuscular hemoglobin concentration has to be normal. The normal reference range is around 32 to 36 percentage, but then still it can be less than 32, but not less than 30%. So MCHC, mean corpuscular hemoglobin concentration, has to be more than 30%. If it is less than 30%, then definitely it is more towards hypochromic. It cannot be normochromic. That's very important, right? Now, what are the causes of normocytic normochromic anemias? The most important cause being acute blood loss. It can be sudden and significant blood loss, such as which occurs due to trauma or surgery or major gastrointestinal bleeding. The second important cause could be chronic diseases like chronic kidney diseases or chronic inflammatory conditions like rheumatoid arthritis, systemic lupus erythematosus, or even chronic infections like HIV, tuberculosis, and so on. Third important cause is bone marrow disorders like aplastic anemia, where there is failure of bone marrow to produce enough red blood cells. It can be myelodysplastic syndromes, and that is basically disorder of abnormal red cell productions, or sometimes in the cases of early cases of leukemias, you find normocytic normochromic anemias. It can be due to some endocrine disorders like hypothyroidism as well as endocrine insufficiency, and that again resulting due to impaired red blood cell production. It can be nutritional deficiencies. Most often we tell nutritional deficiencies can result in microcytic as or macrocytic, but sometimes in case of early stages of vitamin B12 deficiency, there can be normocytic normochromic anemias. Hemolytic anemia. Some hemolytic anemias, particularly autoimmune hemolytic anemias or hereditary spherocytosis, they can present with normocytic normochromic blood picture. And last but not the least, it can be medications and toxic exposures to certain chemotherapeutic agents and certain antibiotics. So these are the various causes of normocytic normochromic anemias. Now let's look into the mechanism of normocytic normochromic anemia. The first important mechanism is because of reduction in the erythropoietin levels, and this occurs in most often, most commonly in chronic kidney disease patients. What happens when there is a reduction of erythropoietin levels? Then that leads to decreased production of red blood cells from the bone marrow itself, and that results in normocytic normochromic anemia. The second important mechanism is increase in the pro-inflammatory cytokines. This happens in cases of inflammatory conditions such as rheumatoid arthritis, systemic lupus erythematosus, or even inflammatory bowel disease. These are all the chronic inflammatory conditions. What these cytokines do is they upregulate the expression of hepcidin. Okay. Now we know that hepcidin is an important component of iron metabolism. Whenever there is upregulation of expression of hepcidin, that leads to the trapping of iron within the macrophages and hepatocytes, which results in impaired utilization of iron for RBC production, and that results in normocytic normochromic anemia. The third important mechanism is it can be because of invasion or infiltration of the bone marrow and thereby leading to destruction of red blood cells. Conditions like chronic infections such as HIV, AIDS, or even chronic hepatitis can induce inflammation and they affect the bone marrow's ability to produce red blood cells, okay, which results in normocytic normochromic anemia. Sometimes they can directly invade and hamper the production of red blood cells. Okay, so these are the some of the causes or mechanisms of normocytic normochromic anemia. So that's the reason why you should not neglect any case of normocytic normochromic anemias. How do you evaluate whenever you come across normocytic normochromic anemias? The first and the foremost thing is that we all know the criteria, right? The first and the foremost thing is that you ask for a reticulocyte count. Now, if the reticulocyte count is increased, what does that mean? That means the bone marrow is trying to compensate for some loss, right? The bone marrow is functioning properly, and these are hyperproliferative anemias. Okay, so the cause could be hemorrhage or hemolysis. Hemorrhage, as I told you, acute blood loss could be because of trauma, surgery, or GA bleed. Hemolysis, it can be because of immune hemolytic anemias. We talked about autoimmune hemolytic anemias, right? It can be because of microangiopathic hemolytic anemia or even paroxysmal nocturnal hemoglobinuria. Okay, so on all these conditions, the anemia is normocytic normochromic, but reticulocyte count is increased. Now, conditions where reticulocyte count is normal or decreased, then we can think of these conditions where the marrow would be normal, like anemia of chronic disease. The bone marrow is normal in the sense, it's not hyper proliferative. It can be normal or decreased production, like for example chronic inflammation, rheumatoid arthritis, chronic infections, HIV, AIDS, TB. Can be because of tumors, it can be endocrine causes, it can be because of chronic kidney and liver diseases, and early iron or vitamin B12 deficiency anemias. Now, if the bone marrow is abnormal, then consider, infiltrative disorders like leukemias, metastasis, or even myelofibrosis, or even plasma cell myelomas. And it can be failure in the production of bone marrow, like hypoplastic and aplastic anemias. Okay, and lastly, as I told you, that could be because of drugs. So that is what you need to understand whenever you come across a case of normocytic normochromic anemia. Ask for reticulocyte count. If it is increased, you have certain causes. If it is decreased or normal, you have certain causes, right? So that's all about this very short tutorial. We looked into the important causes, the pathogenesis and evaluation of normocytic normochromic anemias. Thank you for watching. If you have liked this video, hit the like button. Do comment if you have any queries to ask. Don't forget to subscribe because I'll be coming out with many more such videos. And do share if you find this video useful. Stay tuned. I'll be coming out with more interesting topics in pathology. Thank you.